Welcome to the Simply Pediatrics Podcast, simplifying holistic healthcare for infants and children. We're so glad you're here. Join Jennifer Zethner, holistic pediatric nurse practitioner and holistic mom of 3 on a mission. Listen in as she shares the answers to the most asked questions from parents in her practice every day and offers parents practical strategies and actionable steps to support their child's health and well-being. Enjoy this insightful episode of the Simply Pediatrics Podcast and stay tuned for more information at the end of the podcast.
Hi, I'm Jennie Zethner. That's right, I'm here in my car. I don't know about the rest of you, but I find sitting in my car to be very peaceful. It happens to be one of the quietest places I have in my life. I have 3 children. I work full time. I'm busy like the rest of you, and I like to share information, and doing it from my car is most convenient. So I'm going to ask you to please forgive if there's any commotion behind me, any beeping, any dogs barking, ambulances, fire trucks, etc. I'll do the best I can to find quiet places. I assure you I will never be driving my vehicle when I speak to you. I will always be pulled over and parked. I am typically parked waiting for one of my children to come out of an event or something. So that is what I'm doing with my time here. And I look forward to sharing information with you. And again, forgive me for being a little unprofessional being here in my car, but I hope it works. And with that, let's get started.
Today's episode, Ear Infections, Part 2.
Hello and welcome. I'm so happy to be here with you today. We are going to talk again about ear infections, but today I'm going to focus on how to prevent them. And again, we're talking about inner ear infections or otitis media. And otitis effusion. We'll touch on both of those. So the first questions I ask families when they come in and they talk about how their child has had multiple ear infections is to kind of get a better handle on, like, was this an effusion, which would be like fluid that kind of stayed in the ear and has been in the ear, and that's considered like a chronic ear infection, even though that's not really the right word because it's not an infection, it's inflammation in there. Chronic ear infections or otitis effusion is a child that has fluid in the ear ongoing. So each time you go to the doctor, they tell you that your child has fluid in their ear, yet your child doesn't complain and they don't have any fever. And so for real aggressive pediatric providers, they're treating that child with antibiotics every single time, which is very inappropriate. The other type of ear infection or otitis media is when you have that classical child who's in pain, they're running a fever, and your medical provider tells you that there's fluid in the ear, redness, and there's an infection. So 2 different things, but we're going to talk about both of them kind of the same, because to me, we want, an otitis effusion, which is someone who's running around all the time with fluid in there, that often turns into inflammation, and in fact, an infection where you have pain, redness, and a fever. So why? What are the most common reasons that children get fluid in their ears, whether it's an otitis media, otitis effusion, which is an ear infection, or chronic ear fluid? Why? Why did this happen? So common. And it's most common around the 1-year mark. And I'm going to tell you why. Around the 1-year mark, the most common reason that I see ear fluid in the ears, ear infection, whatever you want to call it, is because at 1-year-old, what do we do with all of our kids? Milk. They all start on whole milk. So our milks here in the United States are so inflammatory. Even if you're buying them organic, they're just coming from cows that they're producing the wrong milk, right? They're producing A1 milk instead of A2 milk, and it's incredibly inflammatory. If you haven't seen my podcast about milk yet, then I'll include some links on the bottom here. But what it does is it creates mucus in the body. It does a whole array of issues, but when it comes to our children and their ears, what it does is it creates mucus. And so across the board, I don't even, 85 to 90% of the time when families tell me that their child had ear infections over and over again, it's almost always within that year, between 1 to 2, when they had started drinking milk, that they started with these issues. So the number one thing we do is we take milk out of their diet. And sometimes we need to take all dairy out of their diet as well, because any kind of dairy product can produce mucus, which can lead to ear issues. So we take dairy out of the diet. Other things we look at next are really the environment. So, hopefully your child's not being exposed to secondhand smoke, but we can also have smoke from, inside wood stoves. We can have mold, which is a big, big issue. And then other toxins in the environment, whether you've just done construction, whether you've bought a new car, whether you have things that are off-gassing, all of those things can irritate a child, create mucus, create inflammation in that part of the body. And then we look at other foods that could cause mucus, and those are going to be your common food allergens. So we look at dairy, and then there's nuts, eggs, gluten, and corn. So, we kind of go down the line of looking at all these inflammatory foods, and then just diet in general. Our standard American diet for our children, especially our toddlers, is just sort of sweet, raw fruits. So lots of bread and lots of sweet products and very little protein, very little vegetables for the most part. And those foods in general are going to create mucus and make us get sick more frequently. One of the other reasons we see mucus, ear issues in kids around that age, around 1, is when they're teething. So you really want to support a child who's teething. Apparently, as adults, if we tease, we'd be like in bed all day because it's incredibly painful. So with that pain comes mucus, and that can also lead to issues if it's coupled with a poor diet, issues with the ear and fluid in and around the ear. Things that we can do to help our children, other than removing those foods from our diets, right? So dairy being the number one, what other things can we do to assist our children? We touched on this a little bit in the last podcast. I talked about cranial sacral work with your local chiropractor that does cranial sacral therapy. You can also do ear drops that contain either mullein, tea tree oil, lavender, garlic. There's blends that you can buy. There's pure mullein or garlic oil. All of these help to decrease the inflammation in that ear canal there and by the tympanic membrane. So very, very helpful for children to help them feel comfortable and help to decrease inflammation. The other thing you can do if you're still nursing, or if one of your other children are still nursing and you have breast milk, is to apply 1 to 2 drops of breast milk into that ear. If you don't know this already, breast milk heals everything. We can use it on our skin, our nose, our eyes, our ears. We use it everywhere, and it really is very healing. So 1 to 2 drops of breast milk in that ear that has that inflammation is also healing. So the herbal eardrops or the breast milk into the ear, and that's 1 to 2 drops once or twice a day. Other things we can do when our child is in pain and having difficulty with that inflammation in the ear is to do gentle massage around the ear with like a lavender, warm compresses around the ear with some lavender on it, holding it on the ear, putting a warm compress inside of a cup and then placing that cup over the ear is also very soothing for children. We can put them into a warm bath with lavender. You can keep them close to you because it's very, very difficult and very painful when children are having, ear issues. You can utilize arnica homeopathy can help with the pain that a child is having, and certainly consult with your local healthcare provider or holistic or homeopath to see which type of arnica and how much for your child, because that will be based on their age. But that is another way we can something else we can utilize to help them with the discomfort. One of the other common reasons we see ear infections recur is because children have been on antibiotics so much. Once you go on 1 round of antibiotics, it disrupts the entire microbiome of your gut, of your stomach. We have 70 to 80% of our immune system lives happily within the organisms that live in our gut. And when we disrupt those organisms down there with antibiotics, even one time, you're kind of set up to get sick again. So we hear this often. They were on 1 round of antibiotics and then they're on another round of antibiotics. If your child is in that loop of being on antibiotics, especially for these ear issues, stop the antibiotics, get a good probiotic so you can recolonize that child's gut health with the good microbes that they need in there. Remove the factors, the food and the any environmental factors that might be causing the inflammation for your child. Remove them from their diet, remove them from the environment so that you don't see them go on recurrently with ear issues. Ear tubes are very common. All right, so we're going to talk about that briefly. ENT seems to be getting more and more aggressive with placing tubes into children's ears. I'm seeing even 1 ear issue and they want to place tubes inside of children's ears. Okay, so a tube gets placed inside of the ear, the eardrum that's in there, so that when that canal back there, the eustachian tube, when it fills up with mucus and irritates the tympanic membrane, there's a pinhole there with a little tube so that the drainage can come out. So that's what the tube is doing, right? So is it stopping the inflammation? No. Is it decreasing the episodes of infection? I'm not sure either, because the fluid is still back there. It's just draining out of the ear. And it's going to decrease some of the discomfort, because now we don't have mucus building up in that eustachian tube and leaning up against the tympanic membrane and causing pain. So instead of that tympanic membrane possibly rupturing, which I'll touch on in a moment, it's draining through the tube. But this is just like a Band-Aid, right? So is it preventing the inflammation from does it stop the inflammation from occurring? No. So when tubes get placed into children's ears, all it's doing is kind of bypassing the system. It's draining the fluid back out of the ears, but it's not stopping what's causing the fluid to begin with. So ask these questions when your medical provider starts talking to you about putting tubes in your child's ear. So is that necessary? Maybe we should figure out why they have fluid in there to begin with. Okay, so ask these questions. And if your medical provider can't answer it, find a chiropractor in your area, find a holistic provider. You can access me virtually if you'd like to, so we can kind of get to the bottom of why your child is having these issues. But the tubes aren't going to solve what's causing that inflammation and that mucus to begin with. Ruptured eardrums, they can be a little scary for families for sure. So what's happening there when an eardrum ruptures? It sounds horrible and very scary. And it's pretty common though. And it isn't dangerous, and they do heal. But we don't want them to happen, of course. So what's happening when that occurs? So like we talked about in the first podcast about ear infections, is that the eustachian tube back there in our face here, right, connects the nose, the mouth, and the ears together. And when we get a little bit of mucus in there, we can see that with our tools that we look at in the ear, right? I can see that with my otoscope, whether there's a little bit of fluid or a lot. I can see that by looking through the otoscope. So if we have a lot of mucus building up in that eustachian tube, what happens is it backs up against that eardrum. And if it continues to build and pressure builds there, the tympanic membrane is very thin and it will just rupture. So it rupture meaning it gets a little pinhole in it and all of a sudden it just oozes out. And it literally looks like a runny nose out of the ear, and often has a little bit of blood too. And at that moment, children usually are screaming in pain. And then once it ruptures, they don't have any more pain, right? Because now it's like it's all been relieved. And then mom and dad panic because now we have like stuff coming out of the ear. So that's obviously needs to be looked at by a provider. But I don't want you to panic over this, okay? Because it does heal. It should be evaluated by your medical provider for sure. But that's like the most extreme version of an ear infection, ear inflammation, is that mucus builds up so much in that canal that it pushed up against the tympanic membrane and it in fact ruptured the membrane. It caused a pinhole and that mucus came out. So it is typically, often they're put on antibiotics, not always necessary, especially if there was no fever leading up to this. So again, I would leave that up to your medical provider when it comes to a ruptured eardrum. And they heal on their own. They should be followed by a medical provider and then viewed in like about 6 to 8 weeks to make sure that it's healed. If you do have a child who has a ruptured eardrum, by the way, and you've been using any kind of herbal ear drops like the garlic oil or the mullein oil, you no longer can put ear drops in. So that is one thing you should note. If you ever see any discharge coming out of your child's ear, you should no longer apply any of those ear oils into that child's ear anymore. It's not going to do anything, and it's not recommended to put anything inside of a child's ear until it's been evaluated by a medical provider. All right, we will have at the bottom of this podcast some links to more information. Again, I try to keep my podcast short, so all of the science and the data and the studies are going to be kind of attached to this. You can go through them on your own. And that is it for me today. Parenting is a journey, and you're doing an amazing job. Stay curious and keep learning. And I'll see you next time.
Thank you for joining Jennie on the Simply Pediatrics Podcast. We hope that the valuable information she shared in this episode will inspire and empower you on your holistic parenting journey. If you would like to learn more about Jennie, her Simply Pediatrics practice, or anything that she spoke about today, Please check the show notes that accompany this podcast, and you'll find all the links and resources you need. You can also sign up for the Simply Pediatrics mailing list so that you receive Jennie's weekly newsletters packed with vital information and holistic parenting gems. If you've enjoyed today's episode, please consider giving this page a like and subscribe to the channel so you don't miss any episodes. And don't forget to connect with us by sharing your thoughts in the comments section below. Follow Simply Pediatrics on any and all of the social media platforms. And if you're interested in an in-person or a virtual appointment with Jennie, please see the contact details in the show notes. Stay tuned for more episodes packed with a wealth of powerful information to support you on your holistic parenting path. See you next time.